And I'm going to quickly transition to our final speaker for this session. Emily Meissen-Sebelius is a project coordinator for Weighing In. You might notice the theme here, a program at Children's Mercy that works to prevent childhood obesity through community collaboration. She's going to be talking about the use of food prescriptions at Children's Mercy. Thanks, Emily.
Thanks, Shelley, and thanks, everyone. I'm going to practice with the clicker here while I get oriented. Those of you who know me know I can talk really fast, so we'll see how well that skill comes in right now as we're nearing the end of the day. So as Shelley said, I work at Weighing In, and you all are familiar with the work we do in terms of collaborating. Many of you are collaborative partners here in this room to prevent childhood obesity. The project that I'm going to talk about, we also took more of an evaluative role, and so I'm going to share some of those lessons learned kind of from that perspective. I'm going to skim over these. Beth talked about food insecurity. Many of you also had the opportunity to talk to Margot Kirkoni about our community needs assessment at Children's Mercy. Last community needs assessment, we did ask questions about food insecurity in the Kansas City metro area. And we're finding that nearly 20% of families in our service area for the community health needs assessment often or sometimes worried about running out of food. And that 16% often or sometimes ran out of food or didn't have money to buy more food. So the program that Shelley mentioned, the food prescription program at Children's Mercy, in an effort to address food insecurity, the hospital established a hunger-free hospital task force. And among other things, that task force has helped raise awareness about food insecurity within the Children's Mercy system, and also spearheaded the inclusion of a 2-question food insecurity screening for patients seen within the primary care clinics at Children's Mercy, which is a large reach. So after that screening was done consistently and documented in the patient medical records, providers had the ability to order this food prescription. And what that consisted of was a $5 coupon to the Truman Medical Center Healthy Harvest Mobile Market. So if you all are familiar with the Healthy Harvest Mobile Market, it travels throughout the Kansas City, Missouri area, various stops, and sells fruits and vegetables at a low cost, and they're high quality fruits and vegetables. So that was part of the food prescription, was that coupon, including some information about the market and also information about fruits and vegetables, benefits of fruits and vegetables. So Weighing In got more involved with that project, as we were also working on a project with our community partners, the WIC program, Truman Medical Center WIC program, and others, and aligning some work in that project to give a similar fruit and vegetable prescription at 2 WIC clinics. So aligning that work and using a kind of similar approach, 2 WIC clinics, Hope Family Care Clinic, as well as the Operation Breakthrough WIC Clinic, provided about 150 of a very similar $5 coupon to the Truman Medical Center Healthy Harvest Mobile Market. There were about 400 last year, or 462 of those food prescriptions ordered at Children's Mercy. And then we were looking at redemption across both of those and found that redemption was really low. And so what next? We had the opportunity to do some interviews with WIC participants at the clinics, as well as do phone calls with families of patients at Children's Mercy who received that food prescription. And I won't go into a lot of detail here, and some of you have seen some of this, but we heard quite a few different barriers. Some of them are more personal, around forgetting the coupon or being too busy to use it. Other things people talked about were related to the mobile market structure itself. The locations or timings of the stops didn't work for them. Maybe it was difficult to get to the market transportation, or because it moved around, just being unsure on how to access a mobile market resource in general. And we also asked people for their advice to improve the food prescription program. So they did talk about having more stops, more locations, having the prescription be to a grocery store instead of a mobile market, increasing the dollar amount. So making that trip kind of more worth the time or the gas money. And better explaining the prescription, the mobile market, the whole concept. But we wanted to know people's big ideas as well. And so actually just this last Saturday, we wrapped up with 6 focus groups with patient families from Children's Mercy who had received the food prescription. We had 4 in English and 2 in Spanish, and about 30 folks participating in these conversations over the last couple of weeks. We asked questions about concerns about food, challenges and facilitators to accessing healthy foods, and their ideas about programs, services, and interventions that would help families experiencing food insecurity connect to healthy foods. So I'm going to share some preliminary ideas, but know that our next steps will be to conduct a rigorous qualitative analysis of the focus groups, and then create a report that includes information both from the surveys and the focus group analysis. So these are some initial thoughts, but as we do that rigorous analysis, we may find other things that sort of bubble up to the top, and certainly these are just a few things that we can easily say from the focus groups. Again, just wrapping up 3-4 days ago. One of the things that really struck us across all the groups was families shared about the many complex healthcare issues that they were dealing with themselves as parents or caregivers, as well as their children, and how that impacted just their daily lives. They talked a lot about how much their kids liked eating fruit, and that getting their kids to eat fruit really wasn't their barrier, but having enough fruit or as much as their kids wanted to eat was more the barrier. Across all the groups, cost came up consistently as a barrier for accessing fresh fruits and vegetables, as well as just having that budget, enough in that budget to purchase the fruits and vegetables that they wanted. But they also talked about transportation or location of healthy foods, fruits and vegetables. Specifically, they talked about the quality as well. So maybe they could access fruits and vegetables, but not those of the quality that they desired. And they also shared a lot of their concerns about the ability of fruits and vegetables to last, and spending money and worrying about those fruits and vegetables going bad. One of the things that came out that was helpful across many of the groups was the WIC program. And I know we have a lot of WIC folks here, so props to you all for the hard work that you do every day to connect families to healthy foods. Many of the families in the focus groups were no longer on WIC because their children were older and not eligible, but talked about that as being really helpful to them. And so the other things that we talked about were asking their broad ideas about what a healthcare provider could do or what Children's Mercy might do to help families connect with healthy foods. And across the various ideas that we heard, some things that were consistent, and also this first one definitely consistent with the telephone survey as well, is just whatever program would need to be convenient, easy, part of my routine. That they were really excited about ideas that would engage their own children in the effort. And they wanted programs or services or connections that addressed the many cultures that we have within our city and within our patient population. They talked about using multiple of the Children's Mercy locations, or multiple locations spread throughout the community like schools, places that were easy to get to and familiar. And then talked about communication, and this kind of fits in with what Donna was just talking about, communication about the program. So whatever the program would be, they talked about that communication had to be consistent and done in multiple ways and multiple times. So examples would be a flyer in an exam room, but also something on social media, something in the mail, a reminder, multiple ways of learning about the program, and then that being done multiple times. So, thinking about this broad socioecological model, some of the ideas we heard really hit on all different levels of that model, which is really interesting and I think really cool. So we heard ideas that were more on that individual level about meal prep groups and cooking groups and gardening groups. We heard ideas that were more about how we as an institution might connect folks to resources for food, but also broader community resources. And we even heard ideas at that top policy level about advocating for affordable housing or affordable childcare, the things that were really eating up the budgets of these families and stretching them in terms of how much money they had left for food. So that was really fast. And I was very excited to be able to have the opportunity and privilege to listen to our patient families, and we're really excited to, again, be able to put this information together and share this back with a Hunger Free Hospital Task Force, but also all of you as weighing in members as we think about how we can work together and also improve the way that we deliver all of our programs to families in the community. So thank you.